Good day. We are the group assigned to discuss the natural history, including the levels of prevention of Ascariasis.
Introduction to disease. So what is Ascariasis? Ascariasis is a disease acquired through ingestion of embryonated eggs which contain second stage larvae of the parasite Ascaris lumbricoides. Ascariasis is the most common helminth infection, has a worldwide prevalence, and is most frequently seen in the tropics and subtropics, in underdeveloped countries that have poor sanitation. Infections are also seen in the southeastern part of the United States in rural areas.
Geographical distribution. So globally, Ascariasis is actually one of the most common helminthic infections. So it is most prominent in countries that are tropical and subtropical, especially in those areas with inadequate knowledge of proper hygiene and sanitation practices, especially prevalent in poor and impoverished areas. So hence, it is unlikely to be seen in developed countries, but may occur as sporadic cases in rural areas. So in addition, human transmission may be negligible if individuals have a direct epidemiological association to pig farms. So usually, these are farmers who take care of the animals. So without proper hygiene and sanitation practices, ingestion of the remnants of fecal matter found in the soil may result to transmission of the disease.
In the small intestine of infected human, adult female worms can lay up to 200 eggs, or rather 200,000 eggs per day. These eggs are excreted from the host's body in the feces. Once in the external environment, the eggs require a period of incubation in the soil to become infective. This incubation period lasts anywhere from 18 days to several weeks, depending on environmental conditions such as temperature and moisture. During this time, the eggs are not immediately infectious. They must undergo embryonation, a process where the larvae develops inside the eggs. The soil provides the ideal conditions for this development, especially in warm and humid climates. Humans become infected by ingesting these infective eggs through contaminated food, water, or soil. Once ingested, the eggs travel to the small intestine where they hatch and release larvae. The stomach acids and digestive enzymes help break down the eggshells, releasing the larvae into the host's intestines. Now let's look at what happens once these larvae are in the human body. After hatching in the small intestine, the larvae penetrate the intestinal wall and enter the bloodstream. This penetration allows them to travel through the hepatic portal system to the liver. From the liver, the larvae migrate to the lungs by the bloodstream, a journey that is essential for their development. In the lungs, the larvae break out of the capillaries and enter the alveoli, the tiny air sacs where gas exchange occurs. This can cause symptoms such as a cough or pneumonia-like symptoms due to the irritation and immune response in the lungs. The larvae then migrate up to the respiratory tract, moving from the alveoli to the bronchioles, bronchi, and trachea. They reach the throat where they are swallowed again, completing a significant part of their migratory phase. This long migration phase is critical for the larvae's development into mature worms. Once swallowed, they return to the small intestines to mature. Let's see what happens next in their development. Once back in the small intestine, the larvae mature into adult worms. This process takes about 2 to 3 months. Adult Ascaris worms can grow quite large, with females reaching up to 30 centimeters in length and males slightly smaller. In the small intestine, these adult worms mate. Female worms produce hundreds of thousands of eggs daily, which are then excreted in the feces, continuing the life cycle. The high egg production of the female worms ensures that many eggs are available to contaminate the environment, increasing the likelihood of infecting new hosts.
In clinical presentation, ascariasis can cause either by migrating larvae or adult worms. Symptoms caused by migrating larvae, this Ascaris pneumonia is characterized by low-grade fever, dry cough, asthmatic wheezing, urticaria, eosinophilia, and mottled lung infiltration in the chest radiogram. Symptoms due to adult worm, it may be asymptomatic infection, the pathologic effects, causes nutritional action, toxic action, mechanical effects, and wandering effects. Nutritional effects may contribute to protein energy malnutrition and vitamin A deficiency.
Ascariasis can cause toxic effects like fever, urticaria, angioneurotic edema, wheezing, and conjunctivitis. Mechanical effects include severe abdominal pain, volvulus, intestinal obstruction, and perforation. Worm migration may lead to biliary or pancreatic duct obstruction, liver abscesses, respiratory obstruction, lung abscesses, and obstructive appendicitis.
Now, let's proceed to diagnosis. The first one to be discussed is stool test. A stool test is a medical diagnostic technique that involves the collection and analysis of fecal matter. Analyzing a stool sample can assist doctors in diagnosing issues related to the stomach, intestines, rectum, or other parts of gastrointestinal tract. X-ray. It uses external radiation to create images of the body, including its organs and other internal structures, for diagnostic purposes. It can show large masses of worms in the belly or lungs. Next is CT scan. A CT scan is a diagnostic imaging procedure that employs X-ray technology to generate images of the body's interior. It captures images from multiple angles within your body to detect worms. Next is ultrasound. It uses sound waves to make pictures of organs, tissues, and other structures inside your body, which healthcare provider can use to look for worms in the liver or pancreas. Next is MRI scan. It uses a magnetic field and computer-generated radio waves to create detailed images of the organs and tissues in your body, helping to determine if worms are obstructing any ducts. Next is endoscopy. This procedure involves inserting a long chain tube directly into the body to examine internal organs such as the gastrointestinal tract. It can detect if worms are blocking the intestines, pylorus, pancreas, or other parts of the gastrointestinal tract.
So for the prognosis, so generally the prognosis for Ascariasis is actually very excellent, especially in those individuals who have taken their medications, which eliminates the worms from their systems. And avoiding factors that could be the cause of reinfection is also very good. So, however, if a person is not treated ahead of time or immediately, what we call the worm burden may occur, which may cause intestinal blockages, which requires immediate surgery.
So let's talk about the complications of ascariasis. Now, when it comes to ascariasis, mild cases don't usually cause complications. However, in heavy infestations, which are more likely in younger children, these can cause some potentially dangerous complications, such as the ones that I have provided in the PPT. Now, let's talk about number one, the obstruction. Now, why does the obstruction occur? Obstruction occurs in heavy infestation of the ascariasis, technically where the ascariasis has become adult worms. And because the child is small, their intestines are small, and a round worm can grow up to 30 centimeters long, they overcrowd the intestines. Now, when they overcrowd the intestines, these can cause severe inflammation, cramping, and vomiting, which can be troublesome for the child. Now, the next thing that occurs, and this is directly related to the obstruction, is the severe or lack of nutrition of the child. Now, because of the blockages, the child isn't able to properly absorb the nutrients that is being fed, which causes slow growth and malnutrition. Another thing that has to be noted is the duct blockages. Now, because of the blockage or the overgrowth of the ascariasis within the body isn't able to function as well as it should. Now, these block the ducts of the liver, the pancreas, and because it's blocking these areas, these causes severe pain for the child. Now, for the treatment of ascariasis, I have noted down 4 antihelminthic medications or antiparasitic medications, mainly albendazole, ivermectin, mebendazole, and pyrantyl pamoate. Now, the function of these medications is to kill the adult worms, thereby stopping the creation of eggs. Pyrantyl pamoate is indicated mainly for pregnant women, as the first 3 medications that I have listed, which are albendazole, ivermectin, and mebendazole, are teratogenic, meaning that they can cause harm to the fetus. Now, if this first line of antihelminthic medications do not work, surgery may be required. The surgery that is commonly done is ileostomy, enterotomy, and the milking of worms, especially the removal of the gangrenous bowel, meaning whatever damage that has been caused by the worms are to be repaired by the doctors, and the creation of an incision to remove whatever adult worms may be left due to a heavy infestation.
So here are different measures that can be taken to prevent ascariasis. One must ensure access to clean water. Next, proper disposal of human waste. And next, to regularly wash hands with soap and water. Next is to handle food hygienically by washing fruits and vegetables and cooking food thoroughly. Another is to avoid contact with human feces. And lastly, educate your children on these practices. By following these steps, we can reduce the risk of ascariasis and stay healthy. Screening and early detection of ascariasis includes stool examinations to identify worm eggs, serological tests to detect antibodies, and community screening programs to monitor and manage infections. These methods help diagnose and treat ascariasis early, reducing its spread and impact on health. Treating ascariasis involves antihelminthic medications to eliminate the worms. In rare, severe cases, surgical intervention may be necessary to address complications like intestinal blockages. These treatments help prevent further health issues and ensure effective recovery.
In the Philippines, there are several public health initiatives that address ascariasis, and here are some of them. For community level, we have Mass Drug Administration. These are conducting regular deworming programs in schools and community centers, targeting children and at-risk populations to reduce the prevalence of ascariasis. We also have health education, which is implementing community-based health education campaigns to promote proper hygiene, sanitation practices, and the importance of hand washing. There is also local sanitation improvements. So this is enhancing local water supply, sanitation infrastructure, and waste management systems in order to prevent environmental contamination and reduce the transmission of Ascaris eggs. For population-level initiatives, we have the national deworming campaigns. So these are basically government-led nationwide deworming programs, which are often in collaboration with schools and health centers to ensure widespread coverage and reduce the overall burden of soil-transmitted helminths. And we also have public health policies, which are basically developing and enforcing policies that mandate regular deworming, improve sanitation facilities, and ensure safe drinking water across the country. And also international collaborations, which is the partnering with international organizations such as WHO and NGOs to secure funding, resources, and technical support for large scale public health initiatives and sustained efforts against ascariasis.